fellow classmates, I'm Maggie Harris, and I'm going to inform you about the time that I nearly died. I sound like I'm about to right now, but I'm not. When I was younger, about 5 years old, I was diagnosed with what's called bacterial meningitis. Bacterial meningitis is actually a common disease where the brain and spinal fluid become infected, and this can progress very rapidly. Although it is common and treatable, if it is not treated fast enough, it may result in death or permanent debilitation. My personal experience is not much unlike the others who were unfortunate enough to contract this virus, but I survived. Most people don't. The formal definition of bacterial meningitis is a bacterial infection of the membranes, or meninges, that surround the brain and spinal cord. This bacterial infection can cause the tissues around the brain to swell. Since the brain and spinal fluids are infected, the swelling interferes with the blood flow and can result in paralysis or even stroke. The bacteria most often responsible for bacterial meningitis are common in our environment and a lot of times can be found in your nose or your respiratory system without anyone even knowing. And sometimes they don't cause harm. Other times, it occurs for no known reason. However, the leading cause of bacterial meningitis is a bacteria called Haemophilus influenza B, which is known as HIV. This bacteria is commonly mistaken as the influenza virus at first, and it usually affects infants and children. The second most common bacteria, I'm probably going to butcher this, is called Neisseria meningitidis, since you'll need to know that at some point in time in your life. More commonly known as meningococcus bacteria, which you all have to get a vaccine for that. So, this bacteria affects people of all ages and tends to occur in epidemics. Bacterial meningitis can be life-threatening, and children between the ages of 1 month and 2 years are the most susceptible to bacterial meningitis, although adults with certain risk factors are also susceptible. These risk factors include abusing alcohol, chronic nose and ear diseases in the past or present, past sustained head injury, and you're also at high risk if you have a weakened immune system due to a previous illness, have had your spleen removed, or are on steroids because of kidney failure. Other times bacterial meningitis may occur is if you had brain or spinal surgery, since obviously those are the areas that become infected, so they'll be open. Other ways one may become susceptible to this disease if they had previously had an infection in their immune system and they had a widespread blood infection. Outbreaks of bacterial meningitis occur in places where you're living together, so military barracks is common, colleges are common. The exchange of body fluids, such as drinking after someone or kissing, are the two most common ways to spread the virus. So the answer to the question is yes, it is contagious, but there are easy ways to prevent yourself from getting it. Some very common signs of bacterial meningitis include a very high fever, headaches, sensitivity to light, stiffness in the neck, and the person that is infected usually has confusion and irritability. Sometimes the high fevers will cause excessive vomiting, and once you are feeling some of these symptoms, if it is bacterial meningitis, things move very fast from there. So if you ever feel any of those things, go to the hospital. Don't go to Marshall Browning though, because they'll tell you it's strep throat. In a lot of cases, if this virus is not treated in 24 hours, you could very easily die from bacterial meningitis. Diagnosing bacterial meningitis is not extremely difficult. However, like I said, Marshall Browning messed it up quite easily. Doctors will look for the obvious: fevers, headaches, squinting, stiff neck. They also look for like a purple reddish rash on your skin. I didn't have it, but I guess it's pretty common. Then your blood and urine will be sampled with what's called a CSF test. And these are cultures that are taken to test for the obvious bacteria that's in your body. And sometimes your mucus is useful too, since it can occur in your nasal passages. The fastest and by far most painful way to test for bacterial meningitis is what's called a spinal tap. And in simple words, this is when a really large needle is injected into your spinal bone and tests your spinal fluids for the bacterial infection. It's extremely painful, so I hope none of you ever have to have that. But once the test results are back, if the CSF findings consist of, okay, here we go, polymorphinoleucoctus, or raised CSF protein levels in the patient is then diagnosed with bacterial meningitis. There is a vaccination to the meningococcus bacteria, which you all had, so you should know that. Although it's used to not be given very routinely, but numbers have been raised recently in the bacterial meningitis category, so the vaccines have also been raised. It is treatable, and it can be treated with simple antibiotics, and even before you're diagnosed, a general steroid may be prescribed to you just to reduce the inflammation inflammation. And once the test results are in, the doctors usually change that. In addition to antibiotics, it is important to replenish your fluids from the loss of appetite, you sweat, you vomit, you have diarrhea. Approximately 600 to 1,000 people contract this disease in the US each year. Although bacterial meningitis can be cured, those diagnosed with it, there is a 10 to 15% death rate from it. The most important factor is that it is recognized and treated early. If it is not treated early enough, and if the patient is not lucky enough to live, approximately 1 in 5 live with permanent disabilities, such as brain damage, hearing loss, loss of kidney function, or limb amputations. 21% of bacterial meningitis cases occur in children as young as 2 months to young adults at the age of 24. So you all are in that age range. If you look in the plain one that's in the middle, this is where you guys fall, and that's the most susceptible. So it's important that you know about it since it is common and the symptoms are much like a flu. As of now, the number of cases is at its lowest that it has ever been, and health officials believe this is due to the increased use of the vaccines. My personal experience with bacterial meningitis included almost all of these symptoms. In fact, it was almost exactly like what I just read to you. I don't remember much about being sick or getting sick or a short period of time after I was released from the hospital, but I do remember very clearly experiencing a 1.77 temperature, which felt like my brain was frying and hardly being able to move my neck or see anything. Also, I can definitely agree that a spinal tap is by far the most painful thing I have ever had to experience, and I hope that I will ever have to. I remember that it makes you very thirsty for some reason. Ironically, I was diagnosed with the second most common bacteria, which usually affects older patients, since I got it when I was 5. But my bacterial meningitis was caught rather late, once again, fault of Marshall Browning. It resulted in 5 different strokes to my brain due to the inflammation and overheating of the meninges. The later this virus is caught, the less likely the patient is to live, and I nearly took my last breath in my parents' bedroom at the age of 5. However, that clearly did not happen. I was treated and cured within a 40-day time frame, and I'm very incredibly lucky that I'm up here talking to you right now. I was lucky enough to live, let alone be able to walk, talk, and do other things just like everybody else. These 5 strokes affected me in 3 noticeable areas that actually happened to be long-term. These effects included a damage to my left ear. I can't hear out of my left ear. I have very restrained right peripheral vision and a neurogenic bladder. But bacterial meningitis is a very serious disease which can result in death. Young people our age are 21% more susceptible to this virus, so I feel that it is very important that you're all informed on exactly what it is, the symptoms, treatments, and statistics. I hope my personal experience didn't make you pity me or anything, but I just wanted you all to know a rather common virus that could affect any of you.